Welcome to Chest Tube Management by Northwell Health. In this presentation, we will discuss assessing the patient, dressing, chest tube and drainage unit, the nursing responsibilities of managing a patient with a chest tube, possible emergency scenarios, and the steps of removal of the chest tube. Prior to setting the chest tube to suction, you need to ensure that the chest catheter is patent. The wall suction should be set at a low continuous suction setting. You should assess the tubing for any kinks or dependent loops, starting at the insertion site and working your way down to the collection unit. At the collection unit, assess for drainage amount, color, and consistency. This unit should always be placed below the patient's chest. While looking at the unit, you need to assess for water seal and that all the connections are tight. When assessing the drainage unit, refer to column B. Here is where you'll see the water rise on inspiration and falling on expiration. This is also known as tidling. Any excessive bubbling in chamber C could indicate a possible leak. When assessing a patient with a chest tube, you should look for any of the following. If the chest tube has become dislodged, if there is a sudden change in the color, consistency, or amount of drainage found in the collection unit, if there is an absence of water seal fluctuation or vigorous bubbling or frequent bubbling in the water seal chamber, if the patient has a drop in O2 saturation or hypoxemia, it should be escalated to a licensed independent practitioner for further care. Alternatively, when assessing the patient with a chest tube, you may spot a sign of the patient's condition improving. You may see less dyspnea or pain on inspiration. A chest X-ray may show improvement. Respiratory status may return to the normal rate for the patient's current age. The drainage will start to decrease. Diminishing and halting of oxygen requirements, and the lung may remain expanded on the water seal. When the patient's condition has improved to warrant a chest tube removal, we need to pre-medicate the patient so that they're comfortable for the procedure. Before the procedure begins, we need to don proper personal protective equipment, or PPE. Explain to the patient that they are going to need to take a deep breath and hold it, and that they may experience some discomfort with the removal. Once the chest tube has been removed, the physician will replace occlusive dressings. They should be inspected periodically to ensure that they are intact and that there is little to no drainage present. Observing the patient for any alterations in respiratory status is also important. The patient will also need to have a follow-up chest X-ray 2 to 4 hours after the removal to ensure that the lung has not collapsed. This slide contains 2 QR codes that will lead you to videos on the chest tubes that you may see at your site. The left code will bring you to our wet suction device. The code on the right will bring you to the dry suction device. Pause the video here, and using an Apple phone, open your camera app to open the link. If you have an Android phone, you will need to download a QR code reader.